Just curious, are you familiar with the difference between a self-funded and a fully insured plan? Have you
I
gone
am.
down that road? Okay.
I've got that.
So our plan works equally well for both. However, when we talk to a self-insured company, this was designed specifically for self-insured employers. And then we start talking about that on the employer side. If they're self-funded, because of the way our plan is set up, we're designed to redirect 10 to 15% of a company's claims from their plan to our plan. We're going to drive claims down. If they're self-funded, that has real value. That bucket of savings typically eclipses and oftentimes to a great degree the FICA savings we're offering them. So we'll touch on
Mhm.
that a little bit. So when we start with the employer, why are we here? Healthcare system. And by the way, good timing. What's been the headline news recently?
Yeah.
Skyrocketing premiums, right? Affordable Care Act
Mhm.
isn't affordable. Gee, who knew? Bottom line is our healthcare system is not perfect, right? So right now, healthcare, I always tell, here's how I put it. Healthcare is easy to find in our country. It's just not always easy to access, especially for, middle income, lower middle income workers. It can be very cost prohibitive. Premiums, certainly, but beyond that, deductibles, copays, et cetera, no secret, right? So there are large portions of our workforce that avoid medical care, diagnosis, visits, physicals because of cost. You know what I mean? So that's where we come in. Our system with our tax incentives and tax codes offer the preventative care side of things at incredible convenience and then most importantly, no cost to the employees.